Governor, on the healthcare, continuing on that line, it was interesting you're saying what you were just saying, and you were in St. Anselm's College in April, where you gave a talk before a group of nurses, and you're proceeding along that line. But where I'm confused with is exactly what is your proposal? I know that you have something coming up in November, but it seems like when I listened to you talk then, I listened to that podcast very carefully. It seems like you're really more in favor of more government involvement. It's hard to understand how traditional free market, how HMOs and so forth would do the types of things that you just mentioned. And then combined with another thing, it seems like right now American manufacturers have this burden of this enormous cost of health care that they're paying has to be factored in to their cost of goods to products. And an interesting thing about Kucinich's plan is that maybe it's a shell game, but it takes that high cost of health care and takes it away from the manufacturer, from the employer, and it's absorbed into taxes or somewhere, but it allows that company to be competitive again on a global market. So I wonder if you could help me understand really precisely what it is that you're proposing.
My plan is very free market, but here's the difference. The doctor doesn't need to work for your employer, shouldn't work for the government, and shouldn't work for the insurance company. The doctor ought to work for you. You as a consumer have to be empowered, and there's several elements to that. Number one, incentives so that as you take better care of yourself and your health care costs go down, it's not the insurance company that just gets the benefit, so do you. The second thing is that electronic medical records, so that you have the portability of your records and your health care. That shouldn't be owned by your doctor or your employer. That's your body, your life, your records, and they ought to go with you. The government has a role. It's not to provide everything for everybody. That's a disaster waiting to happen. The Medicaid program is the most, perhaps, elaborate coverage plan there is. If coverage alone were synonymous with good health, the Medicaid population would be the healthiest population in the country, but in fact they are the unhealthiest. The reason? It's not because of lack of coverage, and it's not because of the presence of coverage. It's because the lack of healthy behaviors and the fact that you're not really managing diseases, you're only intervening at the catastrophic stage. The model has to change. The system's upside down. And until we put it right side up, it's not going to get better.
How are you going to affect that?